different parts to be presented to you from 4 different speakers. We're looking to have a really good discussion as we move through the event today. So what I wanted to do to start with was just give you a bit of background to the PROTECT study, because certainly some of the work has been delivered under PROTECT. So I'm just going to start sharing my screen, and hopefully we will be able to show you what we've been doing and what our intent is under the PROTECT programme. So hopefully you can see that. So the PROTECT programme is the Partnership for Research into Occupational, Transport and Environmental COVID Transmission. And we really have an interest in 3 different areas. We're interested in the environment, in the virus characteristics and human behaviour, and in particular how all those things come together to affect the transmission of the virus in a variety of different spaces. There's a context that we work in is that we recognise 3 main routes of exposure to the virus in any setting, and that's basically summarised as surface, airborne and person to person, and you'll hear more about some of that in the discussion this morning. And what the role of the study is to understand what goes on in the real world, and we're really keen to make sure that it's that real world view that drives the work that we deliver under the programme. And the intent clearly is to make sure that we're informing policy and practice. So we're working closely with policymakers to provide them with the evidence that they need to deliver improvements and management approaches for the pandemic. And we're also working with organisations directly to make sure that they have information that relates to them so that they can do the right things when it comes to protecting their own workers. We're trying to be rapid and responsive. We're looking, for example, let's get back onto that slide. We're looking, for example, at outbreaks. We're looking to make sure that we are on site as quickly as possible and doing things in real time. And that ultimately, when the programme finishes, we leave a legacy for future issues so that people can really understand what we've learned and how that might be applied in different situations. We have a number of themes which you can see here, and I won't go into detail, but the intent is to draw all of this information to provide knowledge that genuinely makes a difference to real people in real situations, including the transport system, as you'll hear later on. We're part of a network of national core studies coordinated by the Government Office for Science, and we're funded currently up to the end of March 2022, but also hopefully beyond that. And we've got more than 200 researchers involved in the programme, so it gives you an idea of the scale. And we cover both academic and government institutions, and using that mix of knowledge and skills to get to those really important outcomes. I'll just finish with this slide because it just illustrates some of the challenges that we've got and the importance of focusing on the real world, because this was a quote from somebody involved in our study, and it just shows some of the challenges that we've got, that whilst we can do the best academic work anywhere in the world, when it comes to implementation, this was a quote from a building contractor who basically said, you know, whilst everything else has changed around me, I still have to deliver to a particular contract, to a particular set of conditions, and therefore we've still got an awful lot to do to make sure that when it comes to providing an environment where people can be appropriately protected, that the whole system is changed, not just elements within it. So hopefully that's given you a bit of a background into the PROTECT study, and as I say, you'll hear more about it as the event goes on. So what I would like to do now is, I can find the right page, move on to the presentations. And the first presentation is from Martie Van-Tongeren. Martie's professor at Manchester University. And Martie, without further ado, I'll hand over to you. Thank you very much.
Thanks, Andrew. I'll try to see if I can get my first test right. Can you see my slides?
We can indeed. Thanks, Martie.
Thanks very much. So thanks, Andrew. I'll for the introductions, I'll talk a little bit about the work that we've been doing as part of Protect on the public transport. I'm responsible within the Protect project for a theme, and the theme is called sector-specific studies. So within that, we apply kind of mixed methods approaches that involve literature reviews, surveys, qualitative studies using interviews of a number of sectors, including the public transport sector, but also we're looking at food processing and construction. And in addition to that, we look to use kind of existing data sets, databases to kind of improve our understanding of the role of work and other activities in relation to the risk of infection and COVID-19 mortality. And we're using a lot of the ONS data, so the infection survey data, the public health data asset, mortality data. And we recently started working with Virus Watch, and we will also be doing analysis with a number of other studies, including Biobank, and we are in the process of setting up a contract with the longitudinal linkage collaboration, all to try to improve our understanding of the role of work and other environments in relation to the risks. Within this presentation, I will talk about a number of activities that we've done within the public transport sector. So I will start off with a bit of information on the literature review that we carried out. I will then talk about some of the evidence from the studies that we did of reanalyzing, kind of analyzing existing data sets, and also kind of looking at what other people found. And then finally, I'll talk a little bit about the interviews that we carried out with stakeholders within the sector. So first of all, the literature review, which was included 28 papers up to May 2021, and I'm sure that since then some papers have appeared, but they were not included in our analysis. So these are a range of publications that are looking at contamination of surfaces and air with the virus, transmission studies, and also studies looking at the control measures and effectiveness. Only 2 of those were conducted in the UK. And the kind of research questions that we're trying to address with that review are listed there below, and I'll go through them briefly one by one. So overall, kind of literature was still kind of limited by May of this year, and I'm sure that will change going forward. Particularly also with the view of the studies that will be presented after me, and which no doubt will publish kind of some important results in the near future. The review, the papers that we reviewed, kind of included some that suggested that the presence of the virus could be demonstrated in some kind of environments, but often the studies kind of included very mixed results, and that's partly because it's really quite difficult, I think, to kind of measure the virus on surfaces and in air, and it requires a very difficult kind of methodologies, but also strategies, I guess, for collecting that data. Kind of empirical studies provided evidence in some circumstances that transmissions occurred of the virus in transport kind of situations, but I guess that, one of the issues there is that it's very likely that you will find papers that find these transmissions, and they will, because that will be interesting findings to publish. So there's probably a little bit of a publication bias here, and it's very difficult to understand how these results are kind of representative for wider kind of scenarios. What I did highlight was that important factors such as proximity and durations are important in terms of risk of transmissions. Risk management measures. So again, the studies were somewhat mixed, with evidence that ventilation systems, for example, had benefits, but maybe not uniformly across spaces, and also kind of window opening configurations in private cars different configurations may kind of have differential impact on the passenger to driver transmission. And then finally, kind of modeling studies suggested that transmissions could be reduced by wearing face masks and by increasing ventilation. So now on to some of the analysis that others and ourselves have carried out in relation to initially transport workers, and it was quite clear from data that ONS kind of published last year that public transport workers are are possibly at an increased risk of COVID-19. And this slide shows the mortality rates for a number of transport workers, and it interestingly shows the difference between those transport workers that kind of transport people compared to transport workers that deliver goods. And you can see in the second column the rate that they are much higher for bus and taxi drivers than other kind of transport workers, whilst the other kind of all-cause mortality, there was hardly any difference. So those kind of strong suggestion that public transport workers are at an increased risk. We did some further analysis using our colleague, well, mainly through our colleagues at ONS that we worked with, and we could make use of a linked data set that linked to census data of 2011 with mortality data, and also with a number of other data sets that allowed us to control for many other variables. And the rows in red in this table are the kind of transport workers, and it demonstrates that the relative risks, and these table here are compared to non-essential workers, so that the relative risk for transport workers as well as other kind of occupations are often reduced when you take into account factors such as geographical location, ethnicity, socioeconomic characteristics, deprivation, etc. So, for example, you can see, I don't know whether you see my arrow, my pointer, that for men the unadjusted or only age-adjusted kind of hazard ratios were just over 3. When you then correct it for other factors, it's much reduced. So that kind of indicates that a lot of the differences in occupational risk could be explained by some of the other factors, but they still remain for taxi drivers an elevated risk. Less so for bus drivers and other transport workers. So we then also kind of looked at what other people have found in the literature, and this study, this slide shows 2 forest plots with relative effects of various that presented by various studies. On the left, it's about infection, and on the right, it's about mortality. And the studies kind of generally show that there are suggestive of increased risk of COVID-19 infection and morbidity and mortality, but also that the results kind of vary quite substantially between studies, and sometimes also within studies. So, for example, interestingly, the rows here that you, again, I don't know whether you see my pointer, but where it says NW1 and NW2, those are evidence from a Norwegian studies in wave 1 and in wave 2, and it shows that there are some differences between wave 1 and wave 2. Perhaps not exactly the way we expected, because some of the risks were actually more pronounced in wave 2 than in wave 1, but it demonstrates that it's quite difficult to combine some of these results and understand exactly what's going on. Also, because often studies are carried out quite differently with different factors that are being corrected for. This slide is a slide that I got from Andrew Hayward from Virus Watch, And this is interesting. It shows the kind of risk of infection amongst approximately 10,000 adults. And it looks at factors such as leaving home for work and or education, using public transport, and frequency of going shopping. And they've done both kind of univariate analysis and then multivariate analysis. And the multivariate analysis are corrected for things like ethnic group and deprivation and other age and other kind of factors. And again, you see similar things that we observed before, is that kind of the effect of leaving the home and for work and education is reduced after you take account of some of the other variables, but they're not disappearing. Similarly, the effect of using public transport is somewhat reduced, but it's still present there after taking into account the effect of other variables. So interestingly, when you look at those three variables, the kind of relative risks for transport, it seems to be kind of fairly reasonably high compared to going to work. But then again, if you look at the actual the impact on the population attributable fraction that they also calculated, actually the most important one appears to be the frequency of going shopping, because presumably that was the most reported activity more often than the other variables. So the other interesting factor is that after taking into account, after including work and using public transport, there weren't really many differences between ethnicity that remained important in the model, and as well as deprivation. So most of the effects of ethnicity and deprivation appear to be explained by the work and transport and retail shopping. Okay, so that's some of the kind of epidemiological analysis. So next I want to talk a little bit about the qualitative stuff that we've done. So really, we wanted to kind of understand from talking with stakeholders, what are the perception of risks, what kind of mitigations are being put in place, and their perceived effectiveness, and what kind of other knowledge gaps, according to the people that we interviewed. And with the help of probably quite a few people in the audience today, we managed to do a very successful, I think, exercise. With the help of people in the sector, and to shape and inform the kind of the design and the interview questions that we posed later on. So the focus was initially on rail and then also bus and taxi, and we carried out semi-structured interviews with experts, organizational leaders, and then also a little bit later on workers and passengers. So we then did various thematic analysis. These results are still being kind of analyzed, and we're kind of currently in the process of writing this up, and hopefully that should be available reasonably soon. So we interviewed 47 people in total, and here you can see the distribution. So in terms of perception of risk, that seemed to be generally consistently reported to be low in transport settings, but not necessarily always constant. So feelings of safety relied on kind of observation of compliance of co-workers and other passengers, and in terms of compliance with cleaning, social distancing, face coverings, and kind of contraventions of mitigations undermined these kind of the perceptions of safety. So also the vaccination program was rolled out during our kind of interviewing period, and that kind of led to increased confidence of passengers, but that was slightly counterbalanced also by the appearances of new variants at the same time. So the confidence to use public transport was seen as a balance between transmission rates, vaccines, mitigations, new variants, and compliance with behavior. And clearly, as I will come back to that as well, it's also need to be seen in the context of when these interviews were carried out, and that was earlier this year. If you then think about what the responses were in terms of mitigations and the effectiveness. So on the right, you see some of the mitigations that were reported by the interviewees, and again, most interviewees kind of reported that the mitigations were appropriate and effective, although it was difficult to determine which of the mitigations were working because they're all introduced at pace and at the same time. So it was clearly the effectiveness of behavioural mitigations was seen as dependent upon the compliance of individuals, and clear messaging about the effectiveness of mitigations was seen to be essential for the confidence for passengers and the return of many passengers. But this slide shows something about the kind of knowledge gaps, and that obviously changed over time. Initially, organizational leaders and experts find it difficult to source consistent and timely information to help their decision making. Especially in the beginning, there was the lack of clear scientific evidence, as we also kind of demonstrated from our kind of literature review, and that's why it's so important that that studies such as Track and Viral that will be presented after this are taking place, and hopefully will kind of address some of those key evidence gaps. Interestingly, the kind of like, and again, not surprisingly, and you see that in other areas too, it's when outbreaks occurred within the kind of workplaces within public transport, it was difficult to determine whether these were work related or whether they were due to kind of other kind of activities that the workforce did. And then, you know, there's a few other things in terms of effectiveness and sustainability of mitigation factors. It'd be important to understand and predict passengers' behaviors in various circumstances, and it's really kind of already kind of clear at that point what the uncertainties were about the demand of public transport and what would look like that in the future in terms of public confidence and shifting travel patterns. So in terms of then overall conclusions. I think it's clear that as with other environments where you put people together in indoor spaces, that there is an increased risk of potentially increased risk of infection and disease. Although these kind of because of implementations of risk mitigation measures, they may vary over the duration of the pandemic. It was also kind of interesting and it's quite clear to people that work in the industries that there were drastic interventions at the start of the pandemic, by particularly in terms of discouraging the use of public transport, and that led to in addition to other kind of interventions such as working from home, led to a massive reduce in the passenger numbers, which still hasn't fully recovered. And I think when speaking to people in the industry, I think they stress the importance that messaging about public transport and the use and the safety of public transport really need to be done very carefully to not affect passenger confidence over a long term. So in addition to the working within the public transport sector, it's not surprising that also the use of public transport may also be associated with some level of increased risk, but that perception of risk was generally low in the population that we interviewed. But that has to be seen obviously in the context of the low passenger numbers at the time and the relatively good adherence to guidance and use of things like face coverings, etc. Now, recently passenger numbers have increased, although they're still lower than pre-pandemic. But importantly, the kind of adherence to mask wearing, social distancing seems to have collapsed in England, and there's also kind of interesting issues about different rules in different parts of the UK. So finally, kind of like lacking of objective data of the effectiveness of different mitigations is probably still an issue, and that need to be addressed, and further results from Track and Viral will hopefully address many of these. Important, I think, is about behavioral issues and the impact of messaging and communication, and I think that's particularly important when perhaps in future some of the current relaxations of interventions may need to be reintroduced if future waves appear to be persistent or other kind of events kind of happen. Clearly, everything needs to be seen in the context of a wider agenda too, and in particular the green agenda and the carbon neutral, where public transport is clearly a key part in terms of sustainability. So I think that's where I wanted to stop. So it rests me to kind of acknowledge some of my collaborators in Manchester Health and Safety Executive, London School of Hygiene, ONS, and UCL. And thank you very much for your attention.
Thank you very much indeed, Martie. Really clear, and I think illustrates that we're dealing with a very complex system here with lots of different constituent parts leading to the outcomes that we see. I'm going to take, if there are any, to welcome our next two speakers. And we have Dr. Leora Malki-Epstein and Dr. Taku Fujiyama from the University College London group. And they're going to be talking to us about the risks of virus transmission on London's public transport vehicles. So without further ado, Leora, over to you. Thank you very much.
Thank you, Andrew. I hope my screen is sharing correctly. So I'm Leora Malki-Epstein. I will start the presentation and then hand over to Taku. This is really a project that has started kind of very early on at the start of the pandemic. It relates to many of the things that our previous speakers were just talking about. So to start with, this is a project that specifically collaborates with Transport for London. We are a smaller group of people than some of the projects that were described here today, but Taku is responsible for looking at crowd behavior and surface touching. I'm here to look at air quality and ventilation. Lena Sirik, PI of the project, is responsible for microbiology, so she would be doing the surface swabbing. Thorsten Stosser, fluid mechanics and computational fluids. Nick Tyler on vehicle design and experimentation, and our postdocs who are the ones doing all the work. So what we're aiming to do, and what we have been doing for a while, is to try and integrate and collect the evidence base for what is happening in practice on buses and on the tube. We are trying to use this evidence to advise on mitigations, as well as to understand the situation on the network, and especially to advise TfL where possible on what could be done to act on the evidence that we're finding. So in terms of the rationale and the way the virus is transmitted, I won't go into too much depth because that's been discussed quite a lot. But we will start really by discussing quite a lot the elements of airflow simulations and air quality analysis. I'll show a particular example that relates to a bus driver protection study that we carried out in the spring of 2020 that also relates very closely to elements that Martie talked about in his first talk on the increased bus driver mortality that was found at the time, and trying to understand what could be done to mitigate against that and to lower that substantially. And then move on to discussing some results from microbiological surveys and passenger crowding. So the virus transmission, as you know, spread by close contact with an infected person, inhaling droplets or aerosols of containing the virus particles, touching contaminated objects, and then your face. As mentioned as well by Cath before me, the viral load and the infectious dose, these are parameters that would be hugely important for modeling. They're not yet well known, and we have to make quite a lot of assumptions. So our project has focused very much on providing the kind of using the public health kind of method of advising extra caution, using the precautionary principle, trying to reduce all of those elements that could lead to transmission without actually being able to quantitatively say exactly what that transmission could be or how it could occur. So our principal interest these days is on looking at passenger protection and how can they remain protected in this kind of environment. The reality is it requires a lot of cooperation from the passengers themselves, but we're still looking at what can be done to passively mitigate against this, whether the passengers are aware, are cooperating, or thinking about it on the spot, or are just busy trying to get to work or to school. So the subject that I'm interested most in is air quality. I felt it was important to actually highlight Moravska's influence in all of this. She's been voted one of the 100 most influential people of the year by Time magazine, assembling a team of more than 200 people to recognize the role of aerosols in spreading SARS-CoV-2. And I'm aware Cath, as well as probably other people on this call, have signed this letter and been working tirelessly throughout the pandemic to make that well known. That debate lasted for a few months, but the importance of inhaling aerosols is still not completely understood. It's still not quantified, but it is recognized that it's an important route. And in some situations, this might be a more important route than in others. So when we're looking at indoor air quality, it's especially important to target those places where ventilation might be quite poor, where there might be specific issues with ventilation systems. Perhaps they haven't been maintained, perhaps they're not working as designed, perhaps they haven't been designed to standards that require high levels of air quality, because there's an assumption that people are not spending much time in a space and therefore it doesn't matter very much. But if we're looking at some way to adapt to a new normal, in indoor air quality is one of the key objectives and one of those layers of protection that can help us improve our experience and be able to resume that new normal more safely. It applies in all indoor spaces, so it's a residential, non-residential buildings, venues for events, which we've looked at quite in depth, shops and schools, and also public transport. So this is not a unique problem for public transport, but it's one that has been highlighted because of the particular challenges on public transport. So to breathe fresh air really is by far the best layer of protection we can have. It's the best mitigation against the aerosol route, even when there are more people in a space. As we said, we don't really know what the infectious dose is, but we do know that increasing fresh air and increasing clean air will lower the concentration of exhaled breath in indoor air. We also know that reducing the duration of an exposure would matter, and that wearing face coverings, the more people wear these, the more effective they are. And they're particularly effective if the infected people are wearing them, so that they're not taking them off to cough into the air around them, but actually allowing the face coverings to absorb all of the droplets and some of the aerosols, and emitting a lot less into their environment. So I will focus much more now on the bus driver protection study as an example of the kind of tools we're using on this project. There are some, I will be showing some simulations run by a researcher, Alex Stubbs, who worked really tirelessly at a very early stage of the pandemic when nobody really knew what was going on, and managed to produce a huge number of simulations in a record-breaking time. The purpose of all of this was to understand how airflows move around a bus, how aerosols from exhaled breath or from coughing might be transported in the air. The simulations are assuming that there's a certain amount of exhaled breath coming out of a passenger's mouth, that passenger is coughing a few times and is breathing for a short time. And then that allows us to simulate where that exhaled breath is going to, and understand how to employ interventions in that case. So what you're seeing here is some results from a simulation with a bus driver in their bus cabin, breathing. You can see their breath in the blue, and a passenger, which we kind of looked at the worst case scenario of a passenger breathing out and coughing on right on the assault screen, very close to the driver and not maintaining social distance. These simulations were carried out on Thorsten Stosser's large eddy simulation code developed, Hydra 3D developed at UCL, and run on supercomputers. And I need to acknowledge the Met Office, who were extremely helpful at that time in allowing the team to have computer time on their computers. So I'm going to show the detail, but for you to understand the problem we're looking at, the problem that was brought to the team was that there was high mortality amongst the bus drivers of TfL, higher than expected in the population, and even studies that were carried out by another team at UCL, the Institute for Health Equity, found that that was not really explained by background or health circumstances in terms of the mortality. And we were looking at what could be done to help the situation. And it was a whole set of mitigations looking at how to increase ventilation on the bus, how to increase airflows, and how to better protect the assault screen. So assault screens on London buses are quite common. They're normally there. It's a kind of very solid perspex screen that's there to protect the driver from physical assault, which unfortunately has been a frequent occurrence. And of course, they were never designed or devised to be hermetically sealed. So of course, there were large gaps around that allowed air to travel from the cabin to the bus, to the driver's cabin. And that meant that the driver was sharing the same air as the rest of the passengers on the bus. Pre-pandemic, these buses could be really busy. They could have even 90 passengers at a time in busy times, and that situation sometimes persisted for an hour or two during rush hour traffic and again in the evening. So it was really imperative in this case to try and separate the drivers as much as possible from the passengers. So all of these mitigations were implemented. The assault screen was modified on 9,000 buses around London, reducing all of the gaps. And really one of the difficulties with retrofitting that people who work in built environment are aware of is that once you have a bus or a building that's already built, it's very difficult to modify it to become completely sealed. So in this case, they were aware that production of these screens meant there were still some gaps around them, and there was some concern over whether that would still pose a problem. So the modeling really looked at how much exhaled breath would find its way into the driver's cab. What you can see here, the detailed simulations, this is an example of one detailed case. There were, you can see 3 horizontal planes being modeled, and you can see the contours of the aerosol concentration. They're shown on a logarithmic scale so that it would be possible to understand areas of higher concentration and of much lower concentration. The color scheme emphasizes even very, very tiny concentrations of exhaled breath of 1 part per million. So it looks probably a bit more alarming than it should be, but that's to allow us to actually visualize the flow and understand it. So the case you're looking at here is the scenario before the pandemic, a passenger coughing and breathing for 1 minute and with the assault screen unmodified. We then tried to compare 9 different cases and cases looking at what happens if the passengers are boarding the bus from the middle door instead of the front so that they can keep more distance from the driver, what happens if the passenger is standing 2 meters away, and compared all of these scenarios to see what happens to exhaled breath in that scenario and how high are the concentrations. What you will see is that in the case where front door boarding and middle door were both open, there was a lot more ventilation on the bus. The airflow actually served to kind of sweep the aerosols away from the passenger and away from the bus driver out to the back door. And of course, if the driver at the same time also opened their own window, they had a really significantly higher fresh air in that window, and that reduced their risk substantially. Okay, sorry, I think yes. So to look at the table of events, these simulations are very difficult to interpret. As you can see yourself, there's quite a lot going on, and they often raise more questions than they can actually solve. So it was important to try and frame them into one particular number that could be compared across a whole set of scenarios, and that is the exposure. And that really goes back to a point raised by Cath before. The duration of the exposure is important. How much of that exhaled breath is being breathed in over time by the driver, and the aim is not to prevent any exposure altogether, because that's just not feasible on buses or on any other kind of public-facing job, but to reduce it really substantially. And we found that the best case scenario where the assault screen was closed off, where the speech holes were sealed off, and where the driver's window was left open and the doors were open while passengers were boarding and getting off, really reduced the concentrations to zero effectively, even at the very high resolution scales that were being modeled here. And that really just an example of how these kind of all the modeling and simulation can be turned into advice on mitigation, or it's a kind of a decision-making tool, looking at all the different types of modifications that could be made and seeing what is left in terms of exposure, how much do they reduce exposure by. Sealing the assault screen speech holes, you can see at the bottom of the table, was quite helpful. Certainly really effective against droplets, but only marginally effective against aerosol transmission because there were still quite a few gaps around. Opening the window was highly effective because then fresh air just comes in and flushes everything out. And modifying the assault screens was also very helpful. And it was implemented by TfL mainly because of the situation where there already was bus driver mortality, and there was quite a lot of anxiety about working in conditions where sometimes passenger numbers were not always possible to control, and where the drivers were obviously on the bus for much longer than a typical passenger is. So trying to reduce their exposure as much as practical was seen to be the best solution to that. So in the end, assault screens were modified, windows were opened, cab ventilation systems, we recommended that those would be improved. It seemed to be fine to return to front door boarding and operate the normal boarding procedures. And we also recommended to open the windows in the passenger saloon and encourage face covering by passengers. So this kind of work is now ongoing. It's been implemented initially. The ventilation systems for bus drivers were immediately improved. That was actually implemented within a few months. And all of that additional protection seemed to resolve the situation in terms of the bus drivers. We are still looking at passengers and at the fact that windows still do need to be open. And that's our current challenge, looking at improving vehicle designs and ventilation standards for vehicles, reducing crowding and increasing fresh air. So my apologies, I should really let Taku continue for a few minutes on the rest of the presentation.
Yes, thank you, Leora. So the next slide, please. Okay, so I'm in charge of the passenger crowding, but here I'm going to present something about passenger crowding as well as surface sampling. So what we are doing is sampling sort of surfaces of the vehicle interiors. And here you see a sort of London underground trains, but also we are sort of investigating London buses. And we also do a sort of video analysis, CCTV, on the surface touches and the crowd behavior. So the idea behind is that to quantify the relationships between the infection risk and the passenger density and the passenger use. Next slide, please. So surface sampling. Yeah, so this, we are taking samples from the surfaces of transport vehicles. Here again, you see sort of London underground trains, but we also sort of collecting a sample from the buses. But I mean, so our finding is sort of in line with the kind of previous project, track project. So basically, kind of no live sort of SARS-CoV-2 virus has been found. So that's very good news. Because we don't have a sort of virus, so we are using sort of the amount of bacteria on the surfaces as an indicator. Some factors behind it would be a sort of vehicle crowding. Obviously, when we took a sort of samples, maybe it was not a sort of period when the trains or the buses are very busy. So maybe this we need to have this in mind. Yeah, next slide, please. In terms of surface touches, we found that actually people sort of touch the surfaces. We understand that when we did this video survey, people were conscious about sort of the lot of sort of infection risk, but still people touch around it. And interestingly, different types of interiors have different patterns of touches by passengers. For example, we have sort of an overhead handle or some middle standing handlebars. So they are kind of how people touch or sort of use these are quite different. And perhaps this depends on the sort of the passenger density or some crowding. And here we can't present sort of the result, but maybe in a sort of a separate session, we are hoping to sort of present the result on this topic. Next slide, please. So we are now developing sort of a risk assessment framework, Leora's work, and also the computer fluid dynamics simulation model, as well as surface touches, sampling, and cloud dynamics things are all integrated into our risk assessment framework. For example, we are sort of calculating the risk each traveling individual would be exposed to, as well as the risk present at key transport links. We know that this would depend on many factors, but hopefully just we can sort of come up with something and sort of inform our sort of practitioners. We hope that okay. And that's so we hope that our framework would be useful for the practitioners. Yeah. Next slide, please. Okay. So that's the end of our presentation. So thank you very much for listening. I mean, it's just sort of still kind of ongoing. We just keep kind of monitoring the situation. But hopefully, we can come up with something very useful to the practitioners. Thank you.
Thank you very much indeed to both Leora and Taku there. Again, really interesting to see how some of these very detailed investigations are helping to provide the information that then feeds into practical tools that organizations can use. And just before I open up for questions, it was interesting hearing about the driver screening issue, because certainly in the Protect project, we looked at a couple of outbreaks in bus depots and saw the kinds of screens that you were talking about, Leora. But what people hadn't thought about necessarily was the early morning meeting where all the bus drivers got together for their daily briefing in a very poorly ventilated room with no social distancing. So I think the key message that we always put out from Protect is that transmission is a continuous risk. You have to think about all the activities that you do over a working day and make sure that you are controlling for each potential route of transmission for every activity that you do, because it's easy sometimes just to focus on one thing and then forget when you go home or you meet somebody in the park and have a hug or whatever it might be. Excellent. So